Okay, we're going to go ahead and get started. And thank you so much to everyone for joining us this evening. I'm Dr. Minerva Romero Arenas. I'm an endocrine and general surgeon at New York Presbyterian-Brooklyn Methodist Hospital. I'm also an assistant professor at Weill Cornell Medicine. I'm one of the founding members of the Latino Surgical Society, and on behalf of the founders, I want to give you a warm welcome and thank you for joining us today. The Latino Surgical Society was established to cultivate, nurture, and support the advancement of Latino surgeons, and today's event falls in line with that mission. As we move into the holidays, I want to just take the time to thank our institutional members for their ongoing support of the Latino Surgical Society, and of course, for the commitment to their faculty and trainees at the institutions. If you would like additional information about individual or institutional membership, you can find information on our website. I also want to take the time to thank our fabulous team of interns, Yatsiri Hernandez, Aldo Treviño, and Alicia Torres, who have done a fabulous job working with LSS on a variety of aspects behind the scenes, and we're really thankful for their contribution. We also want to thank our advisory board, who has provided an incredible amount of advice and guidance as our organization has grown over the past year, and we're really thankful for their time and commitment to LSS and our mission. Last but not least, we want to thank Dr. Valeria Balbuena, who has served as director of our Inside the Operating Room series for the past year, and she's done really a tremendous job. We're really thankful for her efforts in helping us grow this initiative. As you may have seen in your latest noticias, we are seeking applicants for a new Inside the Operating Room director as Valeria's term comes to an end. So please check your email and consider applying to this opportunity. So with that in mind, I want to go ahead and transition our program. It's my pleasure to welcome our session moderator, Dr. Tania Gennell. She's born to Mexican and Peruvian immigrants in Oaxaca, Mexico. She grew up in Southern California prior to studying linguistics at UCLA. She attended the Ohio State University College of Medicine, where she ran the Spanish-speaking free clinic, La Clínica Latina. She completed 2 years of general surgery residency at NYU Long Island before starting a fellowship in Pediatric ECMO at Columbia University Children's Hospital of New York. She is planning to pursue a fellowship in pediatric surgery after completing her general surgery training. And it is a distinct pleasure to welcome Tania. I'm going to go ahead and turn the program over to you.
Thank you so much, Minerva. It is truly a pleasure and an honor to be here. I'm so excited to be part of this event, and I'm so grateful to everything that the Latino Surgical Society has provided for me in terms of mentorship and just overall guidance. And now I'm really excited to introduce our guest of honor today. Today we are welcoming Dr. José Díaz-Mirón for the 9th installment of our series. Dr. José Díaz-Mirón did his undergraduate studies at the University of Texas Pan American in the Rio Grande Valley, and then earned his medical degree at Baylor College of Medicine. He then trained in general surgery at Washington University School of Medicine in St. Louis, and then subsequently completed his pediatric fellowship at the University of Michigan Hospitals and Health Centers program in 2019. Although that does pain me because I did go to Ohio State, I will secretly say go blue. I did not say that if anyone asks. As far as afterwards, he is a pediatric general surgeon, assistant professor of surgery at the University of Colorado School of Medicine, and the associate program director for the Pediatric Surgery Fellowship. And I'm so excited to get to know you and to share this event with everyone.
Thank you, Tania, for that very nice introduction. I'm very happy to be here, and thank you to Latino Surgical Society for having me here today.
So why don't we start with telling us a bit about your background? So where do you come from? Why medicine, and particularly why pediatric surgery?
Sure. So I was born and raised in Mexico, in Nuevo Laredo, so northern Mexico, for those of you that don't know where that is, right across from Texas. I was there, I did my schooling up until freshman year of high school in Mexico, and then I still lived in Mexico where I did my last 3 years of high school before I moved to the States when I started college. Why medicine? I don't know. It seems like since I can remember, I've always wanted to be a doctor. I guess when I was very little, I was exposed to medicine in a very basic level. My uncle is a family practitioner back in Mexico, so I had that limited exposure when I was young. And ever since I can remember, my mom can say that also, that when I was growing up, I'd said that I wanted to be a doctor, and here we are, X number of years later. And then specific to pediatric surgery, I had a fantastic mentor in medical school that, going into medical school, I knew that I wanted to do something with my hands. I knew that I wanted to do something procedural related. So surgery felt like the normal default. Up until when I met Mary Brand, who's one of the pediatric surgeons, or he was a pediatric surgeon back at Weill, now she's in Louisiana. She kind of put me on the path for pediatric surgery, just introduced me to the concept of addressing congenital anomalies and putting kids back on the path to spending their life where they should be with their families. So since then, it's been a goal, and I've had some very great mentors and support along the road that have allowed me to be where I am right now.
I think that mentorship is one of the things that we talk about a lot in terms of how it shapes us, because that's what certainly got me into pediatric surgery as well. So how exactly has mentorship helped you? I know you mentioned in medical school, that's what drove you to pursue pediatric surgery, but what about in residency or any other fellowship for your practice currently?
So I think mentors are crucial for anyone that is seeking a career in academic surgery. And I've been very fortunate, as I mentioned, to find them along the road. When I was a medical student, I worked, I did an extra year of medical school doing the research track back at Baylor, and I worked in the neuroblastoma lab at Texas Children's with Jed Nocturne and Eugene Kim. And I also, worked a little bit more with Mary Brandt, who got me on this this very long and crazy track at some points. Then, in residency, I met Brad Warner. I was in his lab for a couple of years doing intestinal rehab, studying short gut and intestinal failure. And then, multiple mentors, clinical mentors, professional mentors in residency that I still keep in touch with. And the last part of my surgical education was in fellowship, and it was a very big group in Michigan, and I was able to meet several of the mentors that I still rely on to this day. Even this morning, I texted one of my old mentors and I said, "Hey, how would you do this and that?" And it's just very important for you to know that you don't live in a bubble, and that in order for you to have a good academic career, you need to find the people that will put you on the right path and that will push you to achieve the goals that you want. The motivation is the number one thing that will get you to your ultimate goal for academia and surgery, but definitely having someone that will guide you and encourage you and support you is crucial for at least for my personal career.
Yeah, I completely agree. And I think part of that mentorship is also thinking about how to overcome obstacles and how to address our failures. So with that said, what has been the greatest barrier or obstacle that you faced in your career advancement?
In medical advancements, I don't think that I've seen any big obstacles. I would say in broad terms, the biggest obstacle that I had, transitioning from an education in Mexico to an education in the US was the language barrier. And it's definitely a work in progress. And the conversation that we're having right now is a lot more fluent than the conversation that we would have been having when I had just made my transition to the US. And along the road, it's like everything. It's like in surgery, you get better with time, you get better with repetition. And the language difficulties definitely have improved every once in a while, especially when I go back to visit my family. I come back and I have word finding difficulties. I don't know if that happens to you, but same thing when I go back to Mexico. Everything that used to be second nature, all the fluid sentences, or all the high level words that you used to use, you're like, oh my God, how do you say that? It's kind of a little bit embarrassing every once in a while, but it's part of the journey.
Yeah, I think that kind of brings into a nice segue into thinking about how our background and heritage shapes our practice and our career. So I know that you mentioned the language barrier being an obstacle for you. Have you had any sort of other issues with your background, and how has that impacted your career and your practice?
Any other issues with me being Hispanic and impacting the career? Not that I can pinpoint. Thankfully, I've been in groups where support for minorities and support for diversity has been very good. And I am at an institution right now that prides itself, at the University of Colorado, that prides itself on being at the forefront of DEI initiatives, and that is certainly something that I was looking for when I was looking for my first job as an attending. So thankfully, I've come to a place that is very supportive, not only in supporting the goals that I want for my academic career as a pediatric surgeon, but also supporting the advancement of other minorities within medicine, especially here at the university.
Yeah, that's really great to hear. And I'm glad that I know that it can be challenging sometimes, feeling like isolated, especially when you might be the only Hispanic or Latino person in the department. But I'm glad to hear that it hasn't hindered you and that it's been a strength.
Thankfully, we have a division within the division of pediatric surgery. We have a subdivision, our colorectal group, and our colorectal group is quite diverse. So we have Andrea Bischoff, who is a pediatric colorectal surgeon from Brazil. We have Luis de la Torre, who's a pediatric colorectal surgeon also from Mexico. And recently, Dr. Alberto Peña, who essentially pioneered the field of pediatric colorectal surgery, just retired months ago. So he was my partner for probably the first year or so since I got here. So that's been great to have that type of support and presence within my own division, to know that I can go to one of my partner's office and speak in Spanish if I want to, and it's just refreshing.
Yeah. Tell me about your life outside the operating room. What is your work-life balance or integration been like? I know pediatric surgeons are often on call, and so sometimes that can be challenging. So
my work-life balance is a lot better since I stopped being a fellow. Fellowship is fellowship. You just have to go through it. And I had a really good time through fellowship, but it's busier than residency. And as a surgical resident, as a general surgery resident, that things are fast-paced. Things are busy, and when you become the pediatric surgeon, things are a little bit busier. But that is exactly what you want to do, right? You went into that fellowship because that's what you wanted to do ultimately for the rest of your life. And even though it can be limiting on amount of things that you end up doing outside of the hospital when you're in fellowship, it is definitely what you signed up for. It's you're learning what makes you happy. You're learning the procedures that you're going to be doing for the rest of your life on the kids that you're going to be treating. So work-life balance after that has been quite a bit different. So now instead of being in the hospital as frequently as I used to be as a fellow, now it's a little more, I'm not saying that it's easier, but you have a lot more control of your schedule when you become an attending. And probably Minerva can attest to this, because when you suddenly become the attending, then you have your dedicated weeks on service, you have your dedicated operating room days, your dedicated clinic days. It's a lot more predictable. And granted, those weeks on service, that predictability really goes out the door. But for the rest of the time, then it's a lot more easy for you to schedule around. Yeah, so it's easier for you to start picking up the things that made you happy before you started residency or even fellowship. You know, a lot of the things that a lot of the hobbies that I used to have, you know, either went down quite a bit, or I had to put on pause, not completely give up, but put on pause for a little bit. And now that I have a little more time, you know, I'm starting to do some of the things that I used to do quite a bit more frequently before things got as busy.
What are some of your favorite hobbies? What do you like to do?
So I have a dog and a cat, and my dog loves to hang out, and we live next to a very nice park here in Denver, and we go there occasionally. And since, you know, living in Colorado, the mountains are an hour and a half, depending on which one you want to go. So from the outdoors perspective, living in Colorado has been great. I can go and do, you know, a nice hike with the family, or I can we can go. We have epic passes, so we go also to ski on the mountains. Right now, we don't have that much snow yet, but once it gets a little bit better and a little better conditions for skiing, then we'll be going there as well.
Oh, that's wonderful. It's nice to hear that there's some hope for some hobbies after fellowship.
Listen,
great.
You can continue doing your hobbies at any point. I probably just needed to be a little bit better at managing my time when I was in your shoes.
Yeah, understandable. So speaking of being in my shoes, what hope for rising students do you have aspiring to become surgeons?
So I think that we still have quite a bit of ways to go for the Hispanic community to make the appropriate representation in the ranks of academia within surgery. You know, our specific demographics are growing quite fast in the U.S., but that is not reflected in the leadership ranks. So my hope is that all of you and all of us can rise to the ranks that, you know, many of the other groups have risen to. So I want to see a Hispanic president of the American College of Surgeons. I want to see a Hispanic president of any of the other surgical societies to reflect the true demographic, the true population in America. We need to also reflect that in medicine.
Yeah, completely agree. I think that's why I'm pretty grateful for the Latino Surgical Society, because it helps kind of foster that environment and allows us to feel that we have that support, and puts together events like this to help us realize that, you know, we can do it. I think that for people that aspire to be pediatric surgeons like myself, seeing someone like you that has made it is really inspiring, and so it gives me that hope that I can accomplish this as well. So it's really nice to hear that sort of perspective, and I thank you for sharing your story with us.
Pleasure.
Yeah. So I also wanted to ask a little bit more about what what you have, if you have a specific style in the operating room? Is there something that you like to do, or you have a tradition?
A style in the operating room. Not sure if I have a style, but definitely I do a lot of you know, grading in the operating room. I talk to my fellows and I say, this is going to be this is your grade for this operation. And surgery is a lot of repetition. Surgery is a lot of being meticulous, and I like to have that translated that into my operating room cases. So I don't know if I have a particular style, but definitely, I like things just like we all do, things done in a particular way, especially when you're dealing with kids that are very, very small. So there's very little room for error when you're dealing with a kid that's a kilo or a kid that's 2 kilos. So meticulous and slow and gentle dissections. I do. I'll take that back. I do have one thing that I focus on a lot: steri-strips. Yeah, and it's just part of the deal. It's just part of being a pediatric surgeon. I got to Michigan when I was a fellow, and I was looking at everyone perseverate over steri-strips, and I was like, why are you focusing so much on this steri-strip? But now I'm that guy. I'm the guy who likes to cut the steri-strip to the size of the incision, actually smaller than the incision, so that it looks a little bit smaller as an optical illusion. So yeah, I do that. So I became that person.
That's okay. I think a lot of us are trained to think of that, because I know that when I put steri-strips, I always see my mentor behind me, making sure that they are perfect. We measure them to cut exactly over the incision. And I know exactly how that feels. So I feel that my ingraining has begun early in my career, and for that, I am thankful.
Yeah, no, you get graded on the way that you put your steri-strips on. They all have to go in the same direction. They all have to be cut the size of the incision. Yeah.
Oh, I'm so glad. I'm so glad Dr. Corrin has taught me that. I'm very grateful to him for that. He's been a wonderful mentor. So I also wanted to ask you a little bit more about your practice. So I know that you do general pediatric surgery. Is there a particular area that you focus on?
So I have quite a bit of experience in intestinal failure, being in a basic sciences lab, and I still have that interest in dealing with these complex patients in a multidisciplinary fashion. So I attend those weekly meetings with our GI colleagues that do intestinal rehab. So that, thankfully, with the advances that we have for intestinal failure patients, we are performing less and less of the operations that we used to perform routinely for someone that comes in with short gut. Now we have very good ways of delivering nutrition, gatics, things like that will get kids over the hump, and maybe they won't even need a surgery. So that's an interest that I've had since I was a resident because of the background that I had. But in addition to that, I like lots of minimally invasive, like complex minimally invasive procedures. I was fortunate enough to have a very robust training in advanced laparoscopy. So some of those cases that push me, that I feel that are pushing me during any particular case out of my comfort zone, I usually welcome those. And just the chest. The chest is a good area. Thoracic surgery was one of the fields that I had considered when I was a resident. I considered several other specialties before doing a 360 and coming back to where I started. So I started general surgery, wanting to become a pediatric surgeon. I also considered transplant, thoracic, colorectal surgery, but ultimately, I felt that pediatric surgery was still calling my name at the end of the day.
Yeah. I mean, it is the best subspecialty, so I'm very biased.
Yeah.
I mean,
You said it, not me.
Let's agree. I think that that's just the way it is. Sorry, everyone else. But I'm not sorry. How often do you go back to Mexico?
Not as frequent as probably I would like. So my hometown, I haven't been to my hometown in a while.
Mhm.
But when I go to visit my family lives in South Texas now. So we spend Thanksgiving in San Antonio with my sister and her family and my parents. We recently went as a family to the Riviera Maya, and we spent the week there. And occasionally we go to central Mexico. My parents lived in Mexico City for a couple of years, and we visited them quite a few times. But to my hometown, it's been a while since I've been back to Laredo.
Yeah, I don't think I've been back to Oaxaca since I left, so I should probably work on that. But it'd be
I've been
nice
wanting to go to Oaxaca for a long time. One of my pastimes is having some good food, and Oaxaca is at the top of the list for Mexico.
Said it, not me.
Yeah, yeah.
Yeah, I agree. I think Oaxaca is probably the best of Mexican food. One of the pediatric surgeon attendings at Columbia asked me if I had any spare time to make some mole. I was
Oh gosh, does he
like,
understand what it means? Yeah.
trying to explain it. If Dr. DeFazio is on the call, she'll know that it's Dr. Duran. So the least I could do was offer some sympathy tamales that my family made, and he liked those. But we'll see how the mole adventure ends at the end of my ECMO fellowship. But it should be.
When speaking of tamales, when we were just there for Thanksgiving, and every time that I go and see my parents, or every time that they come here, I either leave with a few dozens of tamales, frozen tamales, and or my parents bring me tamales when they come to visit here. So I also found it's recent. Within the past week, I found one of the people at Children's here in Colorado, one of the cleaning ladies actually brings tamales once a week, and that just blew my mind. So now every Thursday I'm going to be looking for her.
Yeah, I have a spreadsheet because my family's crazy and makes like 500, 600, and we just send them everywhere. My uncle just mailed me some, but I don't live in the fanciest building in New York City, so one box got stolen. I may have cried, but there's 6 dozen on the way just in case to somebody else's house, which I think is pretty speaks volumes of how much love there is in our culture for sharing and for food, which I'm 100% okay with. And that's why I chose this neighborhood also, because it's Hell's Kitchen and there's great food. Yeah. So I'm glad to hear that I'm not the only person that's obsessed with tamales.
Tamales are good. Tamales. Drives me crazy that people say tamale for a singular tamal.
Yeah. Let me take. So it looks like there's some questions. So what do you wish you knew as a medical student before pursuing surgery?
Probably what it meant to really be on call.
Mm-hmm.
So you have an idea, right? As a medical student, you take call, but that doesn't really mean much to you as a medical student back then. And we as medical students, when I was at Baylor, we didn't routinely take overnight call. I mean, every once in a while with sub-Is, we would take overnight call, but that once you're a resident, once you're a fellow, once you're an attending, call is different. Call for a surgeon is different, especially when now that I'm an attending, and now that I have to cover some of the satellite places. So sometimes you can be driving around for a little bit, but the silver lining is that you're driving around for cases that you're actually interested in doing. You want to be treating those kids. You want to be getting those kids home to their families, and now that it's the holiday season, want to get them to their families then at an appropriate time so that they can enjoy their holiday seasons.
Yeah. What advice would you give to students who may be interested in pursuing pediatric surgery? I think there's how to eventually apply to ped surgery as a medical student, how to stand out is particularly the question.
Good question. Just do your best. I mean, do your best. Find good mentors that will push you and will keep you in the right path. And once you're in training, then read up about your cases. Be prepared for any of the cases. Practice your non, practice your incisions. Practice laparoscopy. The more an attending sees that you're ready for that case, the more that you will see. The more that they will let you do. And you know, as you're a self-directed learner now, and you will get more out of your surgical training, general surgery fellowship, any type of fellowship that you go into when you do your homework, you know, and you go prepared for the cases, so that once you're there, you actually shine and you impress the attending, and you're like, okay, so then you're gonna get to do this case because you're prepared for that and you're ready for it.
Yeah. For non-US IMGs, research is said to be a must in the application. For those that may be struggling to get into a research position, what would you recommend for someone hoping to become a practicing general surgeon in the United States?
I don't know if the person who wrote that question has already done this, but cold calling or cold emailing people sometimes works. You know, that was one of the strategies that I took when I was trying to find a job for pediatric surgery. You know, there's the APSA website where you look for the posted positions in pediatric surgery. But I also looked at a map and I said, you know, this would be a place where I want to live. This would be a place where I don't want to live. And I started emailing division chiefs, and you know, that it works. You know, just say, you know, this is what I want to do. These are my aspirations. This is my background. This is what I'm good at. Send them your CVs. And if applying formally to a research position hasn't worked out yet for you, then try cold emailing some people that you know have some labs that you're interested in.
Yeah, I think persistence is key, and I think it's hard not to feel frustrated, but I think I try to use that as a motivator. That's what has worked for someone like me in the past. Now, having completed fellowship and being out into practice, what do you wish you knew as a PGY4 applying into PEDS fellowship?
That I probably didn't have to go to all the interviews that I went to. That was stressful and expensive, and so to put that in perspective, I went on 30 interviews for pediatric surgery, and that's obviously before COVID, when you actually had to fly all over the states, and some Canadian places too. But yeah, I mean, I went on 30 interviews. It's not what I recommend, but that's what I did, and it was expensive, tiring, and you know, thankfully I was in a residency place where a lot of my co-residents were amazing, and they supported me, and my mentor supported me, and the program leadership also supported going to the interviews. But yeah, you have to pay it back, because a lot of your co-residents will sometimes take call for you, or let you leave early so you can catch a flight. I think the way that we're doing it right now with virtual interviews is a lot more humane, because you know, when I was a fourth year medical student, either I was in an airport, I was post call going to an airport, I was coming back to call.
Yeah. Any particular advice for those entering the interview trail?
Just show them why people need to take you into their program. Just you have done the work. You have done everything in your power to be a strong applicant. You've had the good mentorship. You've had the good academic development time. So right now you don't have to publish everything in basic sciences. When I was in your shoes, I was still very interested in basic sciences. Now I'm more focusing on a career in clinical research. But whatever you decide to do with that academic advancement time, do you want to do basic sciences research? That's fine. Do you want to do clinical research? That's fine. Do you want to do an additional fellowship? That's fine as well. Just something that will make you stand out, and something that will complement the goals of what you're really trying to do eventually with your career. So find the good mentors that will help you in the road. It's a challenging road to be a pediatric surgeon, but it's totally worth it. I have the best job in the world right now.
What would you identify as a quality that all aspiring academic surgeons should possess?
Grit, definitely. You got to keep doing it. I mean, it's sometimes not the easiest to get something that you want. In pediatric surgery, getting a fellowship in pediatric surgery was a little bit challenging, but determination, grit, passion for what you want to do, because eventually, I mean, this is going to be your career. This is going to be the rest of your life. If you are not happy with the particular field that you're in, then additional training is going to be very difficult, very challenging. As I mentioned, fellowship was a little more labor intensive than general surgery, but it would have been not enjoyable if I wasn't enjoying the cases that I was doing on a daily basis, and in caring for the kids, and liking the operations with some of my attendings, and it's you need to set yourself up for success. You need to be in a field that actually interests you, and so you can shine, and so you can actually not see it as a job, more like the ends to your ultimate goal, to your ultimate career in surgery, whatever field that you want to go into.
And lastly, this is kind of a big question. What would you identify as your most meaningful accomplishment?
Meaningful accomplishment. So it's still a work in progress, but Denver is pretty dense with the Hispanic population. It's about 30% of the population in Denver is Hispanic, and the surrounding area. So Aurora is the city also where Children's Colorado is located, and is very heavy on the Hispanic population. And when I was recruited here, I had the idea of a pediatric surgery clinic that was specifically focusing on the Hispanic population, so that we could provide care in a language and cultural concordant fashion. And I started that clinic, that first pediatric surgery clinic in Colorado, in October of this year. It's still a work in progress, as I mentioned. Not that many people showed up during that first clinic, but I'm hoping that as word of mouth goes out and people know that this is a resource available for them, that more and more of our community will be able to see someone that can speak the language and have the same has the same cultural background that they have. Because there's quite a few papers out in the medical literature that support that patients feel better when they're treated by other minorities, that when they're treated by someone that speaks their language, and that can even translate into hopefully better outcomes and easing their stress at coming for a surgical consultation. It's not easy for a parent to bring their 1-year-old kid to see me and me telling them, hey, your kid needs an operation. It's not something that they want to hear, but doing it in the same language, at least it helps.
I just want to say how remarkable it is that you've been able to even start this, because it is not an easy feat at all. And so I think it's pretty incredible that you're doing this to help our community and hopefully going to have such a big impact. That's just incredible. Congratulations. And that's wonderful. Like, I'm so thrilled that there are people in the field that are thinking about this and making it happen, because I think that's one of the biggest barriers in access to care and equal care. So that's amazing.
I agree. So you can't really you can't really turn your head when it's 30% of your patients. And it feels like I was a medical student in Houston, and every day that I went in for my rotations, every day I was talking to someone in Spanish. And the further I got in my training and residency, it was not as frequent. In fellowship, it became a little more frequent. But now that I'm in Denver right now, it feels like I'm back where I was for medical school. And I speak Spanish very, very frequently when I'm in the hospital. And I think it's refreshing for the parents who come and they're in the hospital and they're stressed because their kid is sick, to be talking to a provider that understands the language, understands the background that they have to.
Yeah, and I think being able to explain it in terms they can understand builds a sense of trust that I have found even with an appendectomy is just, it's life-changing. And I think that effort that you've created to make this clinic is going to really have a profound impact. So I salute you.
So.
So it looks like we have this upcoming portion that's modeled after the show Inside the Actors Studio. So it's usually a line of rapid fire questions. So just tell us the first thing that comes to your mind, all right? Are you ready? Okay. What is your least favorite word?
Not a word.
Is it tamale?
Huh?
Is it the singular tamale?
Well, yeah, that one too. Yeah, tamale drives me crazy, especially because they put it in. They put it in all the signs even for the Mexican restaurants. They call it tamale.
What sound or noise do you love?
I'll leave whatever sound my dog makes.
What is one of your distinctive operating room preferences? I know we talked about the staries. Is there anything else?
I put Dermabond over the incision, and on top of the Dermabond, I put the steri strips.
Love it. Favorite joke?
Oh gosh, I'm not very good at this. But I had an attending in fellowship that gave a lot of jokes, but God, I'm not very good at it. Did you hear about the 2 windmills? Oh gosh, you see, I'm screwing it up. Something about the reception. Yeah, the reception was great.
Next time you owe us a joke. What is your favorite thing about the OR?
The people.
Yes. What is your least favorite thing about the OR?
Delays.
Is there one thing you do every day?
I get on my Peloton.
Oh, nice. What profession other than being a surgeon would you like to attempt?
Something artsy related with my hands. I have, Valeria knows, I have a wheel and I have a kiln, but I don't know how to use them yet. I decided during COVID that was going to be my purchase, and I'm still waiting to take classes. I've watched a lot of YouTubes, but I still need to take classes.
What profession would you not like to do?
Probably something finance related.
And what is the best gift you have ever received?
Pictures for my patients. I still have one family from Michigan that routinely sends me either text messages with the kid that I treated when they were born, and now that kid is 3 years old, and they still send me printed pictures, and I have them all in my office.
Wonderful.
It's great to see them grow.
One of the best parts of the job, I think.
Yeah.
And I'm gonna add this one. What's your favorite food?
Oh, that's a tough one.
I know.
Yeah. Well, Mexican, the yeah. But
Within food, do you have a favorite?
tacos. I mean, tacos of all varieties. I grew up in northern Mexico, and northern Mexico is very heavy on the meats, so lots of tacos.
Good. So I'm gonna hand it over to my colleague Val. Thank you so much, Val, for everything.
Oh my God, this was so awesome. So like for all the audience, like Pepe was my pediatric surgery fellow when I was a baby intern here at the University of Michigan. And he failed to recruit me to pediatric surgery, but I will forever be in his debt for like teaching me how to take care of the babies. And I still have time to change my mind, right, Pepe?
I think so. I mean,
thank you so much to you and to Dr. Anna for joining us for our 9th installment of Inside the Operating Room. And thank you to all of our participants who tune in this evening. If any of you are interested in learning more about our organization or becoming a member, you can find us at latinosurgicalsociety.org and on the various social media channels at Latino Surgery, including Twitter and Instagram. And of course, the recording for this event will be on our YouTube channel shortly. So thank you all for participating. Y buenas noches a todos.
buenas noches.
Bye.
Gracias. Hasta luego.